Mr. Steve Brine.
Thanks very much, Sir David, and it's a pleasure to see you in the chair, sir. Now, standing here today, back in lockdown again, with a chance of telling the House just this afternoon that it's going to get worse before it gets better, I have to say that 2021 is starting to look a lot like 2020. The difference for me, and the reason why I could support lockdown 3 last week, whereas I couldn't in November, is that we finally have the ultimate release from the deadly cycle of lockdown and release in the form of this COVID vaccine. And I want to warmly welcome this, the UK COVID-19 vaccines delivery plan published just this afternoon. We need to study it, and we will, but the figures suggest we've made a strong start. As the Health Secretary said in Downing Street this afternoon, 2.6 million jabs given to 2.3 million people are the very latest figures. Welcome to the Minister, who is responsible for many of them. And he's just taken his seat at exactly the right time, Sir David, because I do agree with the previous speaker, the gentleman from Leeds North West, that I do think we should be doing this 24/7. I do think that there will be the appetite for that. I think the idea of key workers being vaccinated overnight, and then maybe those in the older categories during the day who don't want to do that during the night, that's absolutely fine. But let's at least give them the opportunity. It might be cold and it might be dark, but I'll make the tea. Look, there's no question that we will see problems, and the Minister will be the first to acknowledge this. Supply is going to be lumpy in the next few days, and that is creating problems, and I can't hide from that. We are off to a flyer in my Winchester constituency, well ahead of many areas. And in fact, one primary care network, Sir David, in my district, has actually delivered already more jabs than the whole of France. But it's nonetheless very frustrating to see a raft of appointments made for this week in my constituency having to be postponed just today because of supply problems. And we can't duck the fact that this does hit public confidence. And I thank the Minister for Vaccine for his engagement with me and the primary care network involved this weekend. And I really, really plead him to help us get this corrected and the deliveries into this part of Hampshire so that these appointments can be made good and carried out as soon as possible. I agree with looking at the delivery plan, such as I've been able to this afternoon, on the publishing of data, of daily national data is so important. Transparency is our best weapon, but also daily regional data will be really important. I want to see areas almost competing with each other with enough supply to better them. If Lancashire are doing better than Yorkshire, I have a funny feeling that Yorkshire will want to do better than Lancashire. This is the sort of national effort that we need to see right now. We need to be jab for victory, Sir David. Get COVID done. Whatever three-word slogan the Minister chooses, let's do it. Now, the Minister knows that it's my strong belief that these awful restrictions on our lives cannot be in place a day longer than they're required. So alongside the published vaccine delivery plan and the daily figures and how we're getting this done, we've got to give the public some hope. The Secretary of State said at the Number 10 press conference in the last hour or so, just over 88% of those likely to get seriously unwell and sadly die from COVID reside within the top 4 priority vaccine groups. So my view is that given the only metric that really counts, and the reason why public support for lockdown is so high is the desire to prevent the NHS from being overwhelmed, logic would dictate that once that threat has gone away, we can start to lift the restrictions, right? We need clear heads if we want to do that. And COVID-19 is not a conspiracy, it's not a hoax. We were right to take it seriously last spring, and we're right to take it seriously now. But we're equally right to demand a plan that dismantles the most draconian laws this Parliament has brought in centuries, and to do that in lockstep with the vaccination programme that we have. We know the plan commits the government to vaccinate the top 4 groups by the 15th of February. That's great. As Chris Whitty, the Chief Medical Officer of England, grimly reminds us, we expect between 7,000 and 10,000 deaths from flu each year in an average year. The most cautious reading would suggest that the vaccination programme should take COVID deaths well below this level. So when we have vaccinated the highest risk groups, what will we do? And when we've completed phase 1 by vaccinating all those with above average risk in late March, what will we do then? These are important questions, the ones that I'll keep asking. We don't lock society down for common colds, for seasonal flu, and we cannot, no matter how awful it can be, do the same for the little understood condition that is long COVID. Now, the many other economic, health and societal impacts of this pandemic are already serious enough, so we need a clear roadmap out of this that the public can believe in, or this year is going to make the last look tame by comparison. I think the petition is right to look at the next phase of the vaccination strategy. There are, though, so many competing groups asking to be put in the front of that next phase. Supermarket checkout staff. They interact with huge numbers of people from multiple households, more than any teacher would during any working day. In a moment. Police officers. Just this afternoon I had an email from a constituent telling me about the work that her son's doing in London. Police officers, maybe they should be top of the next queue. Pharmacists, they're going to play a very central role. I declare my interest in the register in even mentioning pharmacists. They're brilliant, and as a former pharmacy minister, they're going to play a brilliant role in the rollout of this. Maybe they should be top of the next phase queue. And then I'll happily give way to our opening member.
I thank the member for giving way. But would you agree with me when we talk about prioritisation? Teachers are from early years to further ed and higher education. They have a wide spread of responsibilities and contact from intimate care with young children. And also, you think of a secondary school teacher carrying their bags down to each and every classroom where they have to go and teach under certain systems put in place. I don't think where you come into contact with people, I can't think of another group of people that have that much contact with other humans. And I cannot stress that enough.
I do not disagree with the Honourable Lady. She probably thinks that I'm winding up to disagree with the premise of the petition. I'm not. My point that I'm making, before I agree with the premise, is that there are so many competing groups, and while supply is lumpy, supply is limited at the moment, we have to prioritise, which is why phase one has to be right. My overriding message is let's get on with it. Let's have this national programme, let's deliver the vaccine delivery plan, and then we'll pull all of these groups in. Now, teachers, absolutely, I do agree. You know, if reopening and keeping open schools is the government's priority, which the Westminster government says that it is, then surely it's good sense, let alone good politics, to vaccinate our educators. And I say educators because, of course, it's not just teachers, it's support workers and all the other people that make schools happen. And that must make sense, Sir David. But I would just say that if we are going to have schools reopened at the end of half term, then we've almost now lost the opportunity to do so, because to give them the jab and then have 3 weeks for it to take its efficacy, that now can't happen before the end of half term. So there is going to be a gap, however we cut this particular cake. And then let me just finish on talking about early years, which you would expect me to do as the chair of the all-party group for early years. The JCVI obviously identified its groups, and some early years workers will be covered by the groups involving the clinically extremely vulnerable and, quotes, all individuals aged 16 to 64 years with underlying health conditions which put them at a higher risk of serious disease and mortality. So it's not the case that no teachers and no early years workers will be covered in phase one. Of course, some will. In phase two, the JCVI states, and I quote, that vaccination of those at increased risk of exposure to SARS-CoV-2 due to their occupation could be a priority in the next phase. You know, their suggested list includes teachers, and I believe that early years workers should be a high priority based on two key factors, and then I'll close. The early years sector is currently open to all children, unlike schools actually, meaning that staff are coming into contact with similar numbers of children as they were prior to the latest national lockdown. And secondly, of course, in early years it is impossible to socially distance from babies and young children. You know, they need close personal care, changing nappies, treating cuts, just giving the cuddle when they bump themselves. You know, all early years settings are currently open to all children. And of course that's vital in providing the continuity of care and early education to our youngest children. But to support them and to keep them open and to keep those staff safe, I think they have a strong case. Why are they treated differently? The previous speaker from Leeds North West said, well, early years workers are a fairly mild bunch. They do not have a powerful trade union often speaking up for them. They only have me and a few other people in the House of Commons. And that's possibly the reason why. But I think this petition makes a lot of sense. And I think the petitioners, every person who signed this petition, I think it comes from a good place. I think it comes from a will to see our schools and our educators and our young people are treated fairly and kept safe from this awful pandemic. And anything that we can do to roll out the vaccine delivery plan, which the excellent minister, now in his place from Stratford-upon-Avon, will make sure that happens, will move us out of this nightmare, and then maybe I can stop being a Grinch about 2021. Thank you.
Order.